We know from medical literature and personal observation that regular exercise is absolutely essential for patients to enjoy happy and healthier lives as they age. The exercise component of the healthcare equation cannot be stressed too strongly. Exercise performed on a regular basis not only improves physical endurance and aesthetic appearance, but it also can be instrumental in improving athletic performance and has the added benefit of reducing the risk of heart attack, high blood pressure, stroke, diabetes, and obesity. Recent research has demonstrated some potential improvements in emotional health, including lowering levels of anxiety and improving symptoms of depression. As we age, it is difficult, if not impossible, to feel good without exercising. Exercise, as a term and topic, is too general to be of value unless you understand that there are two different types of exercise and exactly what benefits these different types of exercise can have. Telling patients to go exercise really tells them very little, and there is plenty of misinformation out there that can have the unwanted consequence of leading you in the wrong direction. This animated educational material is for everyone. Those who are young, old, sickly, weak, strong, bodybuilders, and athletes will learn from this presentation. Let's clear up the misconceptions and add in a dose of science to a sometimes chaotic, random, and chance approach to achieve a fitness or lifestyle goal. There are many types of exercise. You may have heard them referred to generally as aerobic training, resistance training, and combinations of the two. And that is just a starting point. It is our objective in this segment at MD EDU Online to clarify exercise as a specific activity or combinations of activities to achieve a desired end. We bet you knew that people who exercise regularly generally live longer than those who don't. But did you know that some recent research has revealed that marathon runners and completely sedentary people have similar death rates? Speaking of the varieties of exercise, understand that exercise can be performed casually, like walking in the mall or around the block, and not so casually, as in a planned and scheduled trip to a gym with a specific regimen executed to perfection, leaving the participant sweat-soaked and exhausted, and there is a broad spectrum in between the two extremes. So we have to clarify and define the various types of exercise and what they do. You will learn about aerobic training, resistance training, and the subsets of both types, and how to choose your approach so that you can predetermine your results. You must first have a vision of the goal you want to achieve, and then execute a well-thought-out strategy consistently to achieve that goal. From a medical standpoint, the application of routine exercise in young, middle-aged, and older individuals is critical to maintaining a proper body weight and percent body fat, and in reducing the risk of heart attack, stroke, high blood pressure, diabetes, and other ailments associated with obesity. Exercise is also very useful in uncovering early warning signs for the early development of heart disease. We will elaborate on this later. Many people exercise for reasons other than health. Some exercise because it makes them feel better and gives them a better sense of well-being. Others exercise because their doctor told them to. And some people exercise because they're trying to achieve a goal. The goal is usually either for an event, such as a foot race or a competition of some sort, or to achieve a certain physical appearance. Before embarking on an exercise program, it is very important that you check with your physician first to make sure that it is safe. This is especially true if you are not accustomed to exercising, are over 40 years of age, or you have heart disease. Risk factors for heart disease such as diabetes, high blood pressure, a history of cigarette smoking or high cholesterol, or a family history of premature heart disease or stroke. We will now address exercise and the various types of exercise, and how that relates from a physiological standpoint to transformations within the human body. Different types of exercise target different results. This has been revealed in research articles and studies of human exercise physiology. For purposes of definition and clarity, aerobic exercise is exercise that usually is performed at submaximal intensity and is performed for several minutes or up to an hour or longer at times. These exercises, by definition, are not very intense, and given the exerciser is healthy and not on a medication to suppress the heart rate, The heart rate remains between 70 and 85% of the person's age-predicted maximum heart rate. Examples are walking or jogging slowly, depending on your baseline fitness level. These are repetitive motion exercises in general. We arrive at your maximum predicted heart rate by subtracting your age from 220. So, for a 40-year-old, the maximum predicted heart rate would be 180 beats per minute. When the heart rate exceeds 85% of that maximum, you are no longer in the aerobic range. You then approach the anaerobic range. The anaerobic range is much more intense and is associated with being breathless. Levels of exertion in the anaerobic range cannot be done for very long because of the accumulation of the anaerobic metabolism byproduct called lactic acid. When the intensity of the exercise exceeds your body's ability to deliver and process adequate oxygen to produce energy for the activity, metabolism becomes anaerobic. The lactic acid produced from very intense exercise converts to carbon dioxide, CO2, which is expelled through your lungs with each breath. High levels in the blood of lactic acid stimulate your brain to tell you to breathe harder and faster. This is a way you can know that you are near or above your anaerobic threshold. The anaerobic threshold is the point of physical exertion where if you go any harder or intensely, your body cannot deliver enough oxygen to the muscles to deliver enough energy to continue doing their work. The anaerobic threshold of any individual can be improved through consistent exercise and is very important. The hallmark of reaching your anaerobic threshold is suddenly having to breathe much harder. Another term you need to know is VO2 max. This sounds complicated, but it isn't really. Your VO2 max is the absolute amount of oxygen your body can use and process in a minute of exercising. It can be measured in an exercise physiology lab. The higher your VO2 max, the better you are able to exert yourself without being short of breath. Very fit people have elevated VO2 max levels. Sedentary people do not. And the VO2 max can improve with exercise. It is very important because your perceived level of exertion, as noted by how hard you feel your breathing while exercising, fluctuates with your level of exertion relative to your VO2 max. Any activity that approaches your VO2 max feels harder than an activity that is at a lower percentage of your VO2 max. When measuring your exercise intensity, many use your heart rate as a function of its percent of your maximal heart rate as a good measure. That is a standard and useful measurement, but we prefer to use the perceived level of exertion instead of heart rate. It is simpler. We rate your perceived level of exertion on a scale of 1 to 10, obviously 1 being totally resting, and 10 being going all out as hard as you can. So for the definition of aerobic exercise, we could rate a perceived level of exertion between a 5 and an 8. Anything under a 5 might indicate very light aerobic activity or minimally exerting yourself, and 6 to 8, very aerobic. About a level 9 would indicate you are very close to your anaerobic threshold, and a 10, definitely anaerobic exercise. Any prolonged activity in the aerobic range, after about 20 minutes into the process, starts burning fat as a higher percentage of energy source than carbohydrates. This is important to understand, as you will soon see, if you want to lose body fat. Intense anaerobic spurts generally cannot be done for long periods of time and do not draw energy from fat stores. On the other hand, long submaximal aerobic activity, after a short while, starts accessing fat stores as a source of energy. But, as you will learn, anaerobic very intense intervals does have its place if you're trying to build muscle and strength. By the way, growing larger muscles is referred to as muscle hypertrophy. Common exercises that fit into the category of aerobic exercise would include walking or jogging very slowly, usually at a rate where conversation could be carried on with a partner, swimming casually, or cycling at a pace that is not particularly taxing. This is the definition of aerobic exercise, and protracted and repetitive aerobic exercise tends towards burning fat over carbohydrates when done for longer periods of time. Explosive or short bursts of maximal or near maximal activity are by definition anaerobic and use for energy sources a much higher percentage of circulating and stored carbohydrates. we have a complete weight loss talk, including nutrition, at mdeduonline.com. Aerobic exercise results in physiological adaptations that include changes within the targeted muscles and some changes within the cardiovascular system. We do not want to make this very complicated from a physiological standpoint. However, long, low-intensity aerobic exercise increases the blood supply to the exercising muscles and increases the energy-producing and oxygen-using mitochondria within the muscle cells that provide the energy to perform the exercise. It also increases the number of sarcoplasmic reticulum, which is crucial to muscular contraction within the muscle cells themselves, and shifts the oxygen dissociation curve slightly so that oxygen is released more easily from the hemoglobin molecules within the red blood cells, resulting in a higher delivery of oxygen to the tissues. There are cardiovascular compensations when aerobic exercise is performed over prolonged periods of time. These changes include slight enlarging of the heart that is thought not to be dangerous but rather could be helpful. This results in incremental amounts of blood being contracted from the heart in each cardiac cycle or heartbeat. This is, in medical terms, known as the stroke volume. It essentially makes the heart more efficient per beat by dilating the left ventricular cavity of the heart, its main pumping chamber, resulting in an increased amount of blood pumped per contraction of the heart per minute. We do have a cardiovascular overview on our MD EDU Online website. Anaerobic exercise, on the other hand, is activity that is done at such an intense level that it must be performed in an absence of an adequate amount of oxygen. This results in the accumulation of lactic acid within the exercising muscle itself. There are short bursts of very intense exertion, such as sprinting, swimming very fast, or explosive activity on a bicycle, or lifting moderately heavy weights for multiple repetitions over a fairly short period of time. No human being can perform anaerobic exercise for very long at all before the pH of the blood drops to the point where the person cannot tolerate it and is forced to slow down or quit. The anaerobic threshold is a surrogate for the amount and intensity of exercise a patient can do before anaerobic metabolism takes over. What we are saying is that the anaerobic threshold is the intensity level where oxidative metabolism cannot be the sole source of energy. As long as oxygen is the source of energy, lactic acidosis will not occur. As mentioned, it is possible for athletes and patients to increase their anaerobic threshold over time by repetitive aerobic and anaerobic exercise routines. Aerobic exercise routines have been discussed and are submaximal. Though many people recommend using the heart rate to determine how hard someone is exercising, we prefer to use the breath test, which is another way of saying perceived level of exertion. The breath test means that aerobic exercise is occurring when the exercising person can have a fairly comfortable conversation while exercising. Once the anaerobic threshold is met and exceeded, carbon dioxide is produced in such a high volume that the exercising person finds it very difficult to carry on a conversation. This, of course, is noted by a very rapid breathing pattern. To review, because it is a little complicated, the maximum ability of any individual to take up and utilize oxygen per minute is called the VO2 max. The VO2 max is dependent on the fitness level of the individual and can be increased with the proper exercise regimen. For example, marathon runners and runners of 10K and 5K races have markedly better VO2 maxes than people who do not exercise. Runners who train regularly can increase their own personal VO2 max, raising their anaerobic thresholds, and increasing the amount of work and exercise they can do without entering an anaerobic phase, which again results in lactic acidosis and causes profound shortness of breath and cannot be sustained. There are many strategies that athletes use to elevate their anaerobic threshold. This is very desirable for distance runners, swimmers, and cyclists. For those interested in raising their anaerobic thresholds, it is very important to realize that training at or near the anaerobic threshold is a necessity. Many scientists believe that interval training that involves anaerobic bursts within an aerobic set with forced activity recovery periods raises anaerobic thresholds. This has been scientifically proven through exercise physiology research. Aerobic and anaerobic intervals done repetitively over time, as mentioned, increase the number of sarcoplasmic reticulum within the muscle cells and the absolute number of mitochondria, which are the energy-producing organelles within the cells. These types of exercise activities also increase the vasculature that delivers oxygen to the exercising muscles. This might result in a slight increase in the size of muscles, but not much, and it does not really affect the strength of the muscles very much. Human muscle size and strength are linearly related. That is, the bigger the muscle, the stronger the muscle. The actual strength of the muscle is due to the number of muscle fibers and filaments. Muscle fibers, or filaments, are composed of filaments that are called actin and myosin. These are the proteins in the skeletal muscles that allow them to contract against a resistance. It is the ratcheting of the actin and myosin filaments that causes muscular contraction. The number of muscle cells at birth are fixed and tend to deteriorate over time. However, the amount of actin and myosin within each muscle cell can increase with resistance training. Resistance training is an exercise activity whereupon force is used to create tension within the muscle. There are essentially 3 or more ways to do this. There is concentric contraction of a muscle, as in the form of weightlifting, where the weight serves as the resistance, and the muscle contracting overcomes the resistance and moves the weight against gravity in an upward direction. This type of resistance training creates tension within the muscle itself. The longer or more extensive this tension is created through the full range of motion of the exercising muscle, the better for the development of size and strength. The creation of tension stimulates the muscle cells over time to heal themselves after they become somewhat damaged during the intense exercise. Having endured a strenuous event, the muscles adapt to make themselves stronger by the addition of actin and myosin filaments during the rest and reparative process. This is an adaptive response over time to resistance training. The best way to increase skeletal muscle size and strength is by employing a resistance exercise strategy. As part of this process, rest and proper nutrition have to be employed appropriately. We do not recommend resistance training on consecutive days for a particular muscle group. For younger exercisers, it takes about 48 hours for a muscle group to repair itself fully to be ready for another exercise session. As people reach about 36 to 40 or older, this repetitive time might increase to 3 days or longer, depending on the intensity of the weightlifting session. Inadequate rest can result in overtraining and decrease results and paradoxically weaken the muscle. In addition, since muscle is made of protein and stores energy in the form of linked glucose molecules called glycogen, these have to be replaced through the diet. For bodybuilders and strength athletes, we recommend a higher protein diet. Approximately 1.5 to 2 grams of protein per kilogram of body weight a day would not be too much for optimal performance. Nutritionists might argue that that amount of protein is too much. The timing of eating protein is important, and we recommend that one of these protein portions be taken within 30 minutes after a weightlifting session and spaced out about 6 times a day to make the best use of the protein. The reason for this is because the body can only process so much protein that is eaten at a time. Protein that cannot be put to immediate use is converted to glucose, and then fat, if calories in exceeds calories burned for a period of time. Also, it is important to know that too much dietary protein can trigger gout, a disease caused by too much uric acid, forming crystals in joints that are painful and damage the joint. Athletes who train heavily will need to consume more slow-releasing carbohydrates to maintain glycogen stores within the muscle. It is the glycogen stored in the muscle itself that gives the muscle immediate access to energy. Research has shown that it might take nearly a week to replace a muscle full of glycogen when it has become totally depleted of the same. So people who exercise will need to consume more carbohydrate-rich food. So training or exercising is more than an equation of randomly going to a gym. It involves a strategy, appropriate rest and timing, and dietary modifications. Eccentric muscular tension is the lengthening phase of muscle motion. Eccentric tension is essentially resisting the downward motion after completing an upward weightlifting movement. In other words, this is when the weight is going down after lifting it. A very good way to create enormous muscular tension is through the eccentric phase or the lengthening phase of the muscle against the resistance. Many bodybuilders and powerlifters ignore this. For example, lowering a weight slowly, fighting gravity, though lengthening the muscle throughout the process, does create tension within the muscle itself. For the bodybuilders and powerlifters and athletes, recall that it is the creation of tension in the muscle that is the most important determinant in creating strength and size of that particular exercising muscle. This has been proven within the exercise physiology literature. Muscular exposure to tension is the signal that drives muscle hypertrophy or growth. Years ago, a book was written that spoke of the S.A.I.D Principle. The S.A.I.D Principle stands for Specific Adaptations to Imposed Demands. In layman's terms, this means that any exercising muscle will adapt to whatever demands are imposed upon it over time. The S.A.I.D Principle states that if aerobic fitness is the goal, then aerobic exercise should be performed. If elevation of the anaerobic threshold is the goal, then this will require longer exercise regimens involving time-consuming submaximal aerobic fitness sets. These sets might need the addition of integrated anaerobic interval sets. By this, we mean doing lower intensity aerobic exercise while throwing 30 to 60 second more intense intervals in. For clarity, it would be like jogging for 5 minutes, then sprinting for 30 seconds, then jogging again for 5 minutes, and then repeating the process over the course of 30 to 45 minutes or so. Now, for increased muscular strength, we have to change our plan. To increase the strength and size of a muscle, we have to do exercise that creates large amounts of tension within a particular muscle while exercising. We then need to rest and repeat over and over while slowly increasing the weight we lift or force we use. This tension can only be created through eccentric and concentric phases of exercise, with a couple of exceptions. For purposes of clarity for the more advanced, understand that there are different types of resistance training. There is traditional moving weights up and down, and that is referred to as isotonic exercise. Isometric exercise is pushing or pulling against a static, unmovable structure. It is resistance training nonetheless. Isokinetic exercise is fixed-speed resistance training. This is commonly used to rehab a knee injury, and it has other uses. It does often employ the full range of motion of the targeted muscle, which is good. It adjusts the resistance to the power of the person pushing or pulling, and the device keeps the speed constant. Now, let's talk about range of motion. The simplest is where there is none. And this is isometric exercise, which again is static forces against a static object and uses almost none of the full range of motion of the exercising muscle and joint. We define the full range of motion of a muscle, also known as from, as the normal range of motion for the joint the muscle attaches to if the joint were fully bent, then fully extended. 90 degrees or more is the average for most joints. This is usually measured in degrees of motion, and each joint has different ranges of motion. Sometimes a full range of motion exercise like a squat, taken below parallel, can injure the joint such as the knee, so common sense must be applied. In others, prior injuries might make exercising under a load for the from of the joint dangerous for certain joints. Though employed in the past, we do not recommend isometric exercise unless under the care of an orthopedic surgeon or recommended by your physician. Our reasoning is because it elevates blood pressure while doing it more than the other types of exercise, and because of a lack of range of motion of the exerting muscle limits adaptation and benefit. Note that while exercising, it is normal for your blood pressure to go up. Speaking of types of exercise, we mentioned plyometric exercise, which involves essentially jumping off of a box from a height and then recreating the rebound resistance to create muscular tension and improve athletic performance. So, the S.A.I.D principle is extremely important when considering exercise. We believe that for maximal benefit, any resistance training should be done through a full range of motion of the joint, as long as the joint is not injured. This only makes physiologic sense. So, we have defined all we need to speak about exercise and its benefits. Now let's get a little more specific. The most critical issue after the goal of the activity is decided is to understand how best to achieve it. Improvements in performance that results in temporary damage to the muscle. To enhance benefits, it must be followed by adequate nutrition, rest, recovery, and repair. This is the human adaptive response to exercise. It is important to know that after about 26 years old, most of us are programmed to lose about 1% of our muscle cells per year, though there is some genetic variability. Let's dive in. It is nearly impossible to increase substantially aerobic fitness while trying to increase muscle mass and musculature strength simultaneously to their maximal capability. What we're stating here is that if you want to be a distance runner, then it's best to run distances and stay away from weightlifting to a large extent, but not completely. If, on the other hand, your goal is to lift as much and as heavy a weight as possible, and to have the largest muscles as possible, then we would advise you to steer clear of long aerobic exercise sets. The S.A.I.D principle states that in order to maximize muscular strength and size, which is referred to as muscle hypertrophy, then we have to create high levels of muscular tension within the exercising muscle itself. It also states that when aerobic fitness and resistance training are combined, the training effect will cause adaptations that favor the aerobic fitness side of the equation. This will occur at the expense of the muscular strength adaptations. This is particularly true if the exercises are mixed in on the same day. This is an extremely important statement and clinical fact. If you're training to powerlift or gain as much muscular size as you possibly can, you will delay this process by mixing prolonged aerobic sets in your resistance training program. That is not to say that we recommend doing no aerobic training. However, we do strongly advise that you minimize aerobic training if you're trying to bodybuild or maximize muscular hypertrophy, which is increased muscular size and strength. For the bodybuilders and powerlifters who are watching this video, it is important not to do aerobic and resistance training on the same day if your goal is increased muscle size. That's the take-home message here. It is also important to realize that it is the creation of enormous muscle tension that sets off the biomedical process that promotes muscular hypertrophy within the exercising muscle itself. It is also critical to realize that tension can be created through either the muscular contraction phase, called concentric muscular contraction, or through the muscular lengthening phase, called eccentric muscular elongation. The eccentric phase is often ignored during weightlifting exercises, much to the detriment of the weightlifter. For example, pulling or pushing the weight up is the concentric phase of exercise. Letting the weight back down is the eccentric phase of exercise. So, for maximal muscular hypertrophy, we recommend relatively heavy weights done in a minimum of 4 repetitions to protect the joints, to 8 to 12 repetitions to maximize muscular tension over a very brief period of time. 4 sets per muscle group with adequate 3 to 4 minutes of rest in between should be enough, depending upon your current condition. As you progress, you could add sets. The eccentric phase should be controlled and not completely relaxed. We often recommend stopping a rep and going back up a third, a half, or 2/3 of the way down to maximize the tension generated within that exercising muscle. The inertia of the moving weight will generate more tension when it's done that way. We rarely see strength athletes do that at gyms. If you haven't tried it, we suggest you add it to your routine. We have used this method and put it into practice and have seen statistically significant gains in muscular hypertrophy that we might not have if we had focused exclusively on the concentric muscular contraction. For patients who have less grandiose objectives and want to exercise for reasons of health, well-being, less anxiety, and generally feeling better, we would like to give you a reasonable regimen to follow. Please understand that aerobic and more anaerobic interval training can result in the release of endorphins. Endorphins are hormones made in the human body that mimic that of morphine. This leads to a slight feeling of euphoria, and that might be why exercise can be addictive in a way, and this is a good addiction. This can come from intense exercise that usually crosses the anaerobic threshold into the anaerobic phase. Each person is an individual, however, and your level of endorphins release will be different than perhaps that of your neighbor. For general well-being, weight control, and to reduce the risk of heart disease and obesity, we recommend at least 4 days a week of routine exercise. Since we are not trying to build enormous amounts of muscle mass and strength, but rather increase our VO2 max over time to make our daily living activities less taxing, we recommend approximately 40 minutes to an hour, equally divided 4 times a week between submaximal aerobic with interspersed interval anaerobic training and some resistance training through the use of resistance equipment, either free weights or machines. An alternative would be to do these on alternate days, 4 to 5 days a week. For those who are elderly or have knee and back issues, consider the following. For back pain patients, running on flat ground is bad. Walking on a treadmill on a slight or more intense incline of 3 to 8% will get you tired without hurting your back. Knee injury patients can enjoy the same benefits without undue stress on the knees. We have found that the disappearing staircase machine is great at generating good aerobic and anaerobic sets when adjusted to the correct speed. This does put some stress on the knees, but rarely does it hurt the lower back. We suggest that if you have never done the stairs, to start slowly and target 5 minutes, building your way up to 20 minutes. This burns a lot of calories and really reinvigorates you. A good alternative would be rowing or the elliptical machine, where compression forces on the knees and back are lower. If you're older, don't be afraid to get some advice regarding using light weights and attempt to work your core support muscles. We strongly urge non-exercisers to join a gym and take advantage of the robust trainers there. They are very helpful and creative. Exercise has been shown, when not taken to the extreme, to prolong life, improve quality of life, and reduce anxiety, and to some degree depression, and increase daily functional capacity. It's also been shown clearly that it burns calories and reduces the incidence of obesity, and in doing so reduces the incidence of diabetes, hypertension, and to some degree hypertriglyceridemia. A final comment about body fat. There are 2 types of body fat. Those are the fat you can see under the skin and the fat you can't see inside your abdominal wall around your internal organs. The fat on the inside is referred to as visceral fat. The fat under the skin, yellow fat. Visceral fat is thought by researchers to be metabolically active and dangerous. It is dangerous because it elevates markers of inflammation that have been associated with developing heart and vascular disease. It has been proposed that diet alone will not remove much visceral fat. Some believe that anaerobic sets interspersed with aerobic training might be very effective in removing visceral fat. This last section is for bodybuilders, powerlifters, and serious performance athletes. We are going to address performance-enhancing drugs, also known as PEDs. Yes, people really do use them, and if you choose to use them, you need to know the dangers and what they do and what to monitor. If you are an endurance athlete like a runner, whether 5K, 10K, marathon, or ultramarathon, we understand that some people do not have the ability to train at altitude, where the oxygen content of the air is lower than sea level. Training at altitude has many beneficial effects in that it shifts the oxygen dissociation curve favorably for red blood cells to release oxygen easier at the tissue level, and it raises the red blood cell count measured by elevated hemoglobin and hematocrit levels on a blood test. The kidneys make a hormone called erythropoietin that causes your bone marrow to make more red blood cells. Pharmaceutical additional erythropoietin is called EPO. When EPO is given in the form of shots, it will raise your hematocrit and red blood cell count. This is what brought down many a cyclist in the Tour de France and other events. Hematocrit levels that are too high are very dangerous. Why? Because too many red blood cells in the blood increases the viscosity of the blood, or makes it too thick. Thick blood tends to form clots. These clots can cut off the blood supply to a vital organ, such as the brain and heart. If this occurs, you could suffer a heart attack or stroke. If you choose to use EPO, which we highly discourage, then you must have your hematocrit checked and monitored. If the hematocrit is too high, you'll need to stop the EPO and go give blood or get phlebotomized by a physician until your levels return to the safe zone. Now, let's talk about testosterone and its derivatives. Some studies have shown that testosterone does enhance muscle hypertrophy, when resistance training and diet are optimized. This is why men can build bigger muscles than women. Men have much higher levels of the hormone testosterone. Over the years, many athletes have taken testosterone supplements in the form of shots and other ways. There are supplements that can be taken that supposedly raise native testosterone levels, and there are many of these that are legal on the market. Testosterone itself, whether given topically, orally, or by injection, is not legal, and it is considered a controlled drug. In men, it is normal for blood testosterone levels to decline to some degree as they age. The normal levels are debatable. Low T is a common problem, particularly in diabetics and the elderly, and there is raging debate in the medical literature as to whether supplementation works or not. We have an entire section on the treatment of low T and erectile dysfunction on our MD EDU Online website. If you have low T, discuss it with your doctor. If you're bodybuilding or powerlifting or just lifting weights to enhance your physique and you consider using unsupervised and illegal testosterone, we advise you not to. If you ignore us, consider the following. Exogenous testosterone supplementation must be supervised by a physician with expertise in the field. Too much testosterone can do some very bad things. Let's look at them. Excessive supplemental testosterone suppresses your body's ability to make the real stuff. So, if you take testosterone, your testicles will shrink, and you will likely have a low sperm count. Too much testosterone can be converted to the female hormone, estrogen. Too much estrogen can cause men to grow breasts. This process is called gynecomastia. Testosterone supplementation can raise your red blood cell count and make your blood too thick, just as EPO can. Testosterone supplementation can worsen sleep apnea, and we have, or will have very soon, an entire section at MD EDU Online on sleep apnea. Untreated sleep apnea can be deadly without warning. Women who take testosterone can develop male-like features that are not reversible, including beard growth, clitoral enlargement acne, and a deep voice. Too much testosterone can raise your blood pressure and cause you to retain fluid. If you are a male and taking testosterone, you must have your estrogen levels monitored in addition to your testosterone level. If the estrogen levels are too high, you are genetically a converter of testosterone to estrogen. There is a drug called anastrozole that can prevent some of the conversion, but it has side effects too. There has been an association between prostate cancer and prostate hypertrophy and elevated levels of testosterone. If you take testosterone, you must have your prostate-specific antigen, also known as PSA levels, monitored. If you have had prostate cancer, do not take testosterone unless a physician tells you it is safe. We know that there are temptations to take a shortcut to a healthier appearing you, but some of these shortcuts could shorten your life. So be mindful and careful. Humans are not made, except in the rarest of circumstances, to have 20-inch arms. As far as the supplement industry is concerned, there are some that are legitimate and some not so much. Whatever you decide to take, do your homework and protect your health. Thank you for joining us at mdeduonline.com for your exercise prescription. Please let us know what you think and how this helps you.